Welcome to AATCM, the Emergency Medicine channel. Today we are discussing more about coronavirus or Covid-19, Coronavirus Disease 2019. It started in Wuhan, that's a state in China. From there it spread all around the world and it has produced a lot of mortality, especially in European countries like Italy, Germany. And the mortality rate was in China was around 3%, but now it has increased. That is because in Italy and Germany, the elderly people are mainly affected. Their mortality is very, very high. May not be 3%, maybe 5 or 6%. Okay. So this virus originated in China, spread all around the world now. This virus is mainly affecting our respiratory tract. It's like normal viral fever. You can have sore throat, cough, breathing difficulty, sneezing. This spreads mainly through aerosols. When somebody cough in front of you, the aerosols can spread 1 to 2 meters. The maximum length of aerosol spreading is 2 meters. But the problem is whenever you have cough or sneeze, you try to cover your face with your hands. And this virus will be on the hands. When you touch some surface, it will spread on that. A person who directly come and touch on that surface will get the disease. Okay, so it is not only spreading through aerosols, it can spread even through touching the surfaces. From there another person can get. One important receptor which helps the virus to fix to your lung cells is ACE2, angiotensin converting receptor 2. Okay, through that receptor only this virus enters to your body. Okay, angiotensin receptor 2, ACE receptor 2 has got a very important role in this virus entering to your body. Okay, through that only the virus enters to the lung. Very few numbers will develop complication. More than 81% of the patients will have a very, very mild disease. That means they'll have cough, sneezing, fever, myalgia, body pain, same like any other viral fever. But in some patients, it will become a severe respiratory infection. Very few can go to ventilator and around 2.3 to 2.5% will die. Okay, the mortality rate in COVID 2019 is only 3 initially, but it has increased because now it is affecting elderly individual. Any patient who is having COVID infection, as healthcare professionals, when we treat this patient, we have to use personal protection equipments. You all may be knowing there are different type of masks available. Most of the masks, including surgical mask, will not prevent COVID infection. If you are working in a highly busy ward or OPD, you can use a 3-layer mask, but remember it will not prevent COVID infection. You have to use N95 mask. This mask can be used for 4 to 5 hours. After that you have to change the mask. It is very difficult to wear the mask continuously. So maximum 4 hours you may be able to wear this N95 mask. But most of the healthcare professionals are now using the green surgical mask. This will not prevent COVID infection. Either use a 3-layer mask, it is not freely available now, or definitely go for N95 mask to prevent COVID infection. Another important step in prevention of this COVID infection is frequent hand washing with alcohol containing antiseptic. Most of the hospitals will have this alcohol containing hand washing. There are techniques how to wash your hand with alcohol. If it is not available, frequently wash your hand in continuous running water with soap. Soap water is an alternative for alcohol containing disinfectant, or in hospital you have to use alcohol containing disinfectant. Try to use gloves as far as possible. If it is not available, you can use hand washing technique as a preventive measure. Try to use at least a simple mask so that you will not touch your face frequently. Okay, so a mask can be used even to prevent touching on the face, but always try to use N95 mask when you are treating a patient who is having COVID. Okay, the incubation period of this COVID infection is around 14 days. Normally when you exposed to any viral illness, within 4 or 5 days you get the illness. You have fever, running nose. In 1 or 2 days, maximum 5 days, this will last. Okay, but COVID can last up to that incubation period can last up to 14 days, but normally you get that problem in 1 or 2 days, maximum 5 days. Okay. Now, if you see the spectrum of illness, that is the spectrum of illness is very wide. Okay. Like any other viral illness, 81% of the patients, it is got a very mild infection. You have a very mild sore throat, you have very mild nasal congestion, rhinorrhea, mild fever, myalgia, all these things are seen in 81% of the patient. But some patients, around some 15% of the patient, it will go to a severe disease. That means they will have tachypnea, they have some lung infiltrates, they may require oxygen, but they are not requiring ventilator. Very few patients, like 5 to 6%, may require ventilation. So not BiPAP. BiPAP is not recommended for the treatment of COVID infection because that can even spread the disease to surrounding areas. So BiPAP is actually not recommended, but some areas where the large number of patients are coming, we will have to use BiPAP. Okay. Otherwise, intubation is the treatment of choice. That around 5 to 6% may go to ventilator, and the mortality rate in most of the countries it was around 3%, but in Italy it is increasing very high because the population in that countries are aged population, so their mortality rates are very high. Elderly individual can be affected very fast, and their complications are also very high. If you get a patient who is having suspected COVID infection, we will see what are the lab investigation which are very important. Any viral infection, we do a CBC and CRP. That means complete blood count and CRP. Normally what we see in viral fevers are, you are getting a normal WBC count or slightly lower WBC count. Lymphopenia can be there in many patients. So this may be the finding. Counts may be slightly low. Lymphopenia may be there, and what you observe is CRP can be elevated. Any infection or inflammation, CRP can be elevated. But remember that most of this COVID infection, severe infection, will have a very high LDH level, very high ferritin level. You may be knowing that ferritin is an acute inflammatory phase reactant. Wherever there is an acute inflammation, ferritin can be high. So in a viral fever, ferritin may not be very high, but once the patient go to ARDS or multi-organ dysfunction, ferritin can be very high, very high, around 1000 or 10,000. Okay, so elevation of ferritin is a bad clinical marker of COVID infection, and D-dimer elevation is also very bad, and it gives a very poor prognosis. So remember, for important investigation, elevated LDH, elevated ferritin, elevated D-dimer, lymphopenia, these are the poor prognostic markers of COVID infection. Remember, 81% of the patients can recover without any problem. They will not even go to hospital. They may not notice the infection, it's only a viral infection, but around 19 to 20% may go to the hospital. Around 3% may die because of COVID infection. Most of these deaths are occurring in the elderly individuals. Very young children, COVID deaths are not very common, even infections are very mild. Okay, the definitive investigation to diagnose COVID is, you have to take a throat swab and you have to send for RT-PCR. Normally RT-PCR will give the report in 1 day, 24 hours maximum, 6 hours normally you get the report. So RT-PCR can be the diagnostic test by a throat swab. Another investigation which can tell you the clinical problem in COVID is, the most important clinical problem is lung manifestation. You can have bilateral bronchopneumonia or ARDS, like picture in the chest X-ray. So when you take an X-ray, you can see bilateral infiltrates, or if you take a CT scan, there also you can see bilateral infiltrates. Sometimes X-ray will be a ground glass appearance, but that means lot of bilateral infiltrates in the chest X-ray. So whatever it is, it shows a bilateral pneumonia pattern or bilateral ARDS pattern. Okay. Now some patients, like we have already discussed, that 81% of the patient may not require any treatment. So they can be quarantined at home. So you can keep patient quarantined at home. They should not go out, they should not interact with other person, they should not touch other surfaces so that this disease can spread. They can try to wear a normal mask, because what we have discussed is when you cough or sneeze, the virus can spread up to 1 meters. So if you use a routine mask itself, when you cough and sneeze, these droplets will not go that much distance. It can come down very fast and the length can be reduced and the spread can be reduced. So a mask should be used by two individuals. One is a person who is having respiratory infection, other one is a person who is treating respiratory infection. These are the two individuals should wear mask. But what we are seeing is everyone is using mask, that is we are actually misusing this facility, and soon the mask and sanitizers will come down. Okay, the availability will come down. So only two type of persons should use mask. One is a person who is having respiratory infection. To prevent this COVID infection to others, we have to use a mask. Any type of mask is okay. But a healthcare professional who is treating COVID infection or any respiratory infection, they should use a 3-layer mask minimum or a N95 mask. Okay, so the person should be quarantined for some days and you can keep the person inside. Normally some countries, they quarantine the person up to 28 days. They wait for 2 reports to negative, then only they'll release the person. Once the patient is admitted inside the hospital, we have to always, as a healthcare professional, we have to use a personal protection equipment that contains mask, goggles, caps, N95 mask and full gown. Okay, so personal protection equipment should be used by all healthcare professionals when we are treating respiratory infection, which is a suspected COVID case. Okay, there are 2 important drugs are available now. They are available now. They are even under trial. They are not proven drugs, but many agencies have given recommendation to use these drugs. One is hydroxychloroquine sulfate. Hydroxychloroquine sulfate is primarily used for rheumatoid arthritis. It is used in malaria, but it has got an advantage here, that this hydroxychloroquine sulfate acts on your ACE2 receptor in the lungs. The same receptor is used by the COVID virus to enter the cells. So this hydroxychloroquine sulfate can block this receptor so that it can block the viral entry to the cell and multiplication of this virus. So that is an advantage. Because of this advantage, this drug was used in many other similar viruses and proven that it is beneficial. Okay, since we don't have much treatment options, these drugs are used in almost all countries. So the dose, what I am telling is now is the treatment dose, that is 200 milligram 3 times daily for 10 days. That is a treatment along with azithromycin. Azithromycin is an antibiotic which has got an anti-inflammatory action in the lungs. So this drug is proven to be beneficial in most of the viral pneumonias. Okay, so the routine treatment what is available now is you can use azithromycin 500 milligram 3 to 5 days with hydroxychloroquine sulfate 200 milligram 3 times daily for 10 days. This is available treatment at present. There are newer drugs on the trial. Okay, so these drugs were used in countries like China and Italy, so that they are telling it is beneficial. Okay, so that is about treatment. So you use hydroxychloroquine sulfate 200 milligram 3 times daily for 10 days, azithromycin 500 milligram OD for 3 days. Another drug is remdesivir. That is one newer drug which is under trial used for this COVID infection, but the reports are not yet out. Okay, so that's another drug which can be used. We already discussed what is the advantage of hydroxychloroquine sulfate, that acts on ACE2 receptor. Same drug can be used for a post-exposure prophylaxis or pre-exposure prophylaxis. That means a healthcare professional, a doctor or nurse or an EMT working in a hospital who can be exposed to COVID infection or who is already exposed for COVID infection, they can also take hydroxychloroquine sulfate according to current guidelines. The dose of prophylaxis hydroxychloroquine sulfate is 400 milligram hydroxychloroquine on first day. That means BD. 400 milligram hydroxychloroquine BD on first day with meal. This drug can produce some gastritis, so try to avoid this gastritis by taking PPI, and this drug should be taken along with food. So 400 milligram BD on first day, and after 1 week you have to take another 400 milligram, then weekly 400 milligram. Okay, so first day 400 milligram BD, then weekly 400 milligram OD. For 7 weeks you have to take hydroxychloroquine sulfate. It may prevent this infection. There is no vaccine available at present. There is no other treatment options are proven that that can cure COVID infection. So any healthcare professional can start taking this drug, hydroxychloroquine sulfate, 400 milligram BD on first day, for then every week 400 milligram OD. Remember that there are some side effects reported in books, that is mainly the retinal problem, but this retinal problem occurs only on very chronic use, like continuously daily you are taking hydroxychloroquine sulfate for 6 months. When you examine the eyes, you can see some retinal problem, but that will not occur because of this smaller dose. This only prevents the infection, only prevents this ACE2 receptor blockage and prevents the virus entering to our cell. Okay, so 400 milligram BD on first day, 400 milligram OD every week for another 7 days can be taken to prevent this infection. Hope that you got some understanding about this virus. Virus spreads very fast, so you have to take personal protection equipments like 3-layer mask, N95 mask. Try to take hydroxychloroquine sulfate as per the recommended dose in many guidelines, newer guidelines. There are no treatment options available at present. It's all symptomatic. Thank you.